Every day you see stories about people dying of fentanyl, and the drug continues to plague the nation. Regan Gallo tells us there is some positive news and that death rates may be moving in the right direction.
The U.S. Department of Health and Human Services recently announced a decrease in drug overdose deaths. This 3% decline is the first decrease since 2018, but Arizona is still not following the same trend.
So we come out, and if you look in our van, it's full of Narcan, xylazine testing strips, fentanyl test strips.
Brock Bevel serves his community every day with his nonprofit called Fentanyl Project AZ.
And if you can keep them alive, then tomorrow they have a chance to recover.
And while he is glad to hear the national rate of fentanyl deaths is down, based on what he sees, Arizona has a long way to go before it sees progress. And he's right. According to the Arizona Department of Health Services, from 2022 to 2023, Arizona saw a slight increase in opioid deaths. Bevel believes the potency because of the proximity to the border may be one of the reasons for the increase.
Arizona is the first line of defense. Comes to the border, it comes into Mesa, Phoenix, Scottsdale, Chandler, all of our community.
Dr. Sarah Solik is the Chief Medical Officer of Arizona's Healthcare Cost Containment System, also known as AHCCS or Access. She understands the challenges the state faces.
We're still losing over 5 Arizonans a day to the opioid epidemic, and so the epidemic is still here.
But Dr. Solik believes we are moving in the right direction. She notes the state receives federal money to fund programs like primary intervention, substance abuse coalitions, and naloxone distribution.
There could never be enough naloxone. It's a life-saving drug.
Despite wider distribution of the life-saving drug by emergency services and pharmacies, Bevel says it is not always well received.
But what homeless guy's gonna walk into a police department and say, can I get some Narcan, right? It doesn't work that way.
Dr. Solik says programs like Sonora Prevention Works, which provides human-to-human outreach to distribute naloxone, are so important.
We'll meet you where you're at, and that includes under the bridge, on the street, etc., because your life matters.
Dr. Solik admits this is a multi-layered issue that requires complex problem solving, and for communities across Arizona to lend a helping hand.
We can all make a difference, right, in our everyday lives in regards to people that are impacted by substance use conditions.
Access to treatment is also key to bring down overdose deaths. Dr. Solik says Arizona has 4 24/7 opioid treatment centers, and there are at least 43 treatment and naloxone centers within a 25-mile radius of Phoenix listed on the Access website. In the newsroom, Regan Gallo for Cronkite News.